Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session. We're starting the series this month in the Pride of Caring, issues for LGBTQ caregivers and professionals. And today our first session is going to be how is caregiving different for LGBTQ plus caregivers? And we have with us today Dr. Elliot Sklar and Lucy Barylak, and we're so glad that they're with us today. Before they get started with their presentation, let me tell you a little bit about each of them, please. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. She would also like you to know that she was a caregiver for her mother for about 10 years. And now Elliot. Dr. Elliot Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Welcome, Lucy and Elliot.
Thank you so much. Welcome, everyone, and thank you for joining us today. And I'm hoping that you might join us for other programs in this month's Pride of Caring series. It's a very important time for our community. It does also, unfortunately, feel like our community is under political attack, for a lack of a better term. And in fact, yesterday, the Human Rights Campaign issued a state of emergency for our community. So this is something that we will discuss a little later in our program today, because caregiving does indeed become different for LGBTQ plus caregivers when states pass laws that allow healthcare providers to deny medical care. And this has been the case in Florida, as an example, where I live. Now, I began preparing for our series with Lucy ahead of these political events, and I wanted to begin our series by sharing a personal experience. And I hope that throughout our program and our series, we're able to provide a safe space for sharing and for discussion. That's really our aim. I'm happy to whiz through our data and our presentations and talk more through our series. Now, again, we will be providing everyone a copy of all of our slides and resources today and throughout our series if you have registered. We will also be staying on an additional 30 minutes for an unrecorded discussion that will be completely unscripted and is your safe space and time to talk. So we welcome you to stay with us beyond the hour. Now, you can also feel free to share with us during our program through the chat or by unmuting yourself during our discussion. And since this is the first time that we've actually hosted this series on Zoom without a specific focus on COVID and the inclusion of a lineup of guest speakers, some things that we might be discussing might feel a little personal. So if you would prefer to make yourself anonymous on Zoom, you can change your name and you can also turn off your video. And Minerva, if you would be so kind as to put into the chat how people can change their name, that would be really helpful.
Thank you, Elliot. Good morning, everyone, and welcome. You know, you're so right, Elliot. It's very concerning what is presently happening in regards to the backlash that the LGBT communities are facing. As you said, Elliot, we are hoping that you join us in expressing your feelings and your thoughts. And as Elliot said, this is a safe place to do so. Now, since we're talking about LGBT caregivers, let's discuss what those letters stand for. The current full acronym is actually LGBTQIA+, lesbian, gay, bisexual, transgender, queer and or questioning, intersex, and asexual or an ally. So we'll often, for this particular session, we're going to kind of use the shorter acronym for LGBT for our program. This is it'll be much easier to discuss since we're going to be talking about it a lot.
And I didn't mean to advance the slides so quickly. My apologies. And I'm having some technical issues this morning, so bear with me. But yes, we're, as you said, we're a safe space. There are a lot of different acronyms. You'll see perhaps a lack of consistency in some of our slides and how we refer to things. Bear with us. It's a very large acronym that is evolving. And in fact, some of the resources that we'll be sharing with you, which are national organizations, use completely different acronyms. So the main overarching question for our program today is, how is caregiving different for LGBTQ plus caregivers in 2023, aside from the evolving acronyms? And it has been a while since I've actually asked this question. I'm curious if anyone participating today has any thoughts or anything that they would like to share on how caregiving might be different before I share a personal experience. You can feel free to enter something in the chat or unmute yourself. Well, I don't see a lot of action in our chat. So while you think about that, I'll share that the last time that I actually asked this conference was at a national conference where I presented on this topic last spring. And when I asked the question to the audience in the room, I got a ton of blank stares. And that never really surprises me, because I think that when we think about this topic, we don't really talk about it very much as a society, nor as healthcare workers or educators. And I think we've come to sort of believe that our caregiving experiences are more similar than they are dissimilar. And that may be the case for some people, but for others, that may be quite a bit different. And when we lack the actual experience that someone has, it makes it much more challenging to appreciate the differences or what differences might exist. So I want to begin by sharing with you, as I said I would, a personal experience. And I have had this experience a couple of times with my healthcare provider. I'm an established patient. I have seen my doctor since I think 2016 or 17. And my medical records with the practice clearly state that I'm married. My husband is a patient of the practice as well, same doctor. And this happens each year when I have my annual physical, and when we get to the topic of blood work, I am always asked to get an HIV test. And the last time that I saw my doctor, and the time before that, I was also engaged in a conversation about PrEP, which is prophylactic treatment to prevent HIV transmission. And this has happened every year, pretty much since about 2014 or 15, when PrEP was introduced. And at the time, several health organizations, including the World Health Organization, had declared that all gay men, irrespective of their relationship status, should be on this PrEP medication. Now, I want you to think of your own experiences at your annual physical. And if you're married, did your doctor suggest that you get an HIV test and consider taking medication to prevent HIV, even if you're in a committed relationship? And how would that make you feel? Any takers?
Well, I could say that I would be surprised to be asked that question.
It made me feel concerned, not upset or angry with my doctor, but taken back in the moment. Because I know working in public health, he was right not to assume that my marriage is monogamous from a healthcare practice perspective, and also considering that other organizations, like I mentioned, the World Health Organization, had recommended that all gay men, irrespective of relationship status, take this prevention medication. But we also know that all medications have side effects, right? There's always a weighing of pros and cons. So why would I want to take a medication if my lifestyle didn't warrant it? And that should have been the conversation, I think, between my doctor and I. My husband and I have been together since 2005. And my own personal experience with healthcare, I believe, has been different because I am a member of the LGBTQ plus community. So if my own experiences as an adult of my age have been different, then I imagine that the experiences of others might be different too. And if you're a caregiver, that really has a lot of implications. Right now, as an example, there is talk of no longer requiring health insurance to cover the cost of PrEP, this prophylactic medication to prevent HIV transmission, or not requiring providers to prescribe this treatment if a patient asks. These new healthcare policies are making news in Texas and in Florida. And apparently having to provide PrEP violates people's religious doctrines around potential prevention of HIV infection and behaviors that link with HIV infection. Now, imagine if the same thing was true for cervical cancer screenings, as an example. What do you all think of this? It's the first time, certainly, since I've been an adult living in the United States, where there has been a discussion in the last year of people not having equal access to healthcare. I know it's a little controversial, so I'll keep going, but if something comes to mind, please feel free to share. There have been actually about 417 anti-LGBTQ bills that have been introduced in state legislatures since the start of the year. And that's according to data from the American Civil Liberties Union as of April. That's already more than twice the amount of bills introduced all of last year, and why the Human Rights Campaign has called for a state of emergency. 24 of more than 400 of these bills introduced have been signed into law in 11 states, and a majority of them are healthcare and education focused. However, 2 of them ban drag performances in public spaces. More than 2/3 of the healthcare-related bills this year would ban gender-affirming care for trans youth. 10 of those bills have already been signed into law, according to ACLU data. That's more than triple the number of bills passed in 2021 and 2022 combined. And why the Human Rights Campaign, as I said, has declared a state of emergency, which is actually something we're going to talk about next week in greater detail because it links with long-term care. Now, the reason I'm sharing this is because when our experiences with rights and freedoms, which include healthcare, become different, then so do our experiences as healthcare caregivers. And I've heard over the years from so many seniors in the LGBTQ community that if policies are on the table that relate to our access of healthcare or jeopardize our rights of marriage, these are concerns that people in our community have as they age and also as they become caregivers. And this is even more true for people of color within our community. So I'm just curious again, if anyone has any experiences that they would like to share. Often in our programs, we have a nice mix of both professionals and caregivers. And I think it can always be helpful to have that dialogue. So is there anything anyone would like to share?
I see that we have one person that has phoned in, and you can press *6 on your telephone to join us in the conversation. Everybody on Zoom can just unmute their microphone, raise their hand, put something in the chat box. We'd love to hear from you.
Well, I have to say, Elliot, that that's a really important question, and it's extremely concerning by what you're saying, concerning to me. So how does all of this tie into caregiving issues? It is because our experience with healthcare are different based upon things that like gender and sexuality, identity. We know this to be well documented. In addition, when issues in our environment are present, as Elliot shared, it compounds upon the stress that a caregiver experiences. As an example, in 2023 marks 50 years since the American Psychiatric Association Board of Trustees voted to declassify homosexuality as a mental disorder in their manual. That's quite shocking. So for LGBT caregivers who grew up during a time when their sexuality may have been considered a mental disorder, there may be an added barrier of distrust of mental health providers, and I can understand that, based on personal experience or historical knowledge, which may have implications for both a caregiver and the care recipient. Though healthcare has evolved considerably, the early life experience of today's seniors were undoubtedly shaped by earlier attitudes and beliefs about sexuality. We have hosted this program each June for 5 years or so now, and we host our program in June because, as Elliot said, it's Pride Month. With years of struggle for civil rights and ongoing pursuit of equal justice under the law, as well as the acknowledgement of the LGBT individuals. As for all caregivers, we know that the role comes with many rewards and also many challenges. LGBT caregivers face several unique challenges that are related to their sexual orientation or gender identity, in addition to those Elliot spoke to, his own experience with medical care. LGBT caregivers may also experience emotional stress and isolation, especially if their loved ones are not accepting of their sexual orientation or gender identity. They may also face legal barriers related to marriage, adoption, inheritance, which can complicate their caregiving responsibilities. Another issue that the LGBT caregivers face is the lack of representation and resources specifically tailored to their needs. Many caregivers may not have access to LGBT-friendly support groups or information about how to navigate legal and financial issues related to their caregiving responsibilities. So overall, it's important for healthcare providers and support organizations to be aware of the unique needs and challenges faced by some LGBT caregivers and to provide them with the necessary resources and support they need to provide effective care for their loved ones. LGBT rights have been an ongoing issue in the US, and there has been some instances where certain policies and laws have been passed or repealed. For instance, in 2019, the Trump administration processed a rule that would allow healthcare providers to discriminate against LGBT individuals based on their religious belief. Furthermore, in recent years, several states have passed laws restricting or prohibiting transgender people from using restrooms that align with their gender identity. Recently, these discrimination policies have been increasing. However, it's important to note that there are also ongoing efforts to protect and promote LGBT rights at the state and federal levels. So let's look at some specific challenges that LGBT individuals and caregivers experience that include, well, as I was saying, discrimination. LGBT seniors often face discrimination in healthcare, housing, and employment, which can lead to isolation and lack of access to services. So there's also lack of family support. Many LGBT seniors are estranged from their families or do not have children living with them without a support system in their later years. There could be financial insecurities. Two, due to unemployment discrimination and disparities in income, many LGBT seniors have limited resources and struggle financially in retirement. Now, there's also health disparities, as we were talking about. LGBT seniors are at a higher risk of certain health concerns, including depression, HIV, cardiovascular disease, etc. So there's also a lack of inclusive services. Many seniors care facilities and programs are not inclusive or accepting of LGBT individuals, making it difficult for them to access appropriate care. Now, there's also, we know caregivers, there's social isolation, but LGBT seniors are more likely to live alone and lack social support, which can lead to social isolation and to loneliness. Now, there is fear of discrimination and harassment. Many LGBT seniors are hesitant to reveal their sexual orientation or gender identity due to the fear of discrimination, being harassed, which can further increase their social isolation and lack of access to services. So I've said an awful lot, but I'd like to throw a question at you. I'm curious to know from healthcare workers who might be participating today, do you worry about discrimination among co-workers or other agencies that you work with to support the clients, LGBT seniors? Love to have a little discussion around this because I can say an awful lot about back here in Montreal, even though a lot of changes have been made. I still feel that there is in some organizations, especially in long-term care, that sense of, of discrimination.
Hi, I'm Miranda. I'm from the Camarillo Healthcare District. And it's interesting that you bring that up because I do feel there's still some conservative thinking, within our agency. So while we do have different coalitions, in regards to LGBT and our senior population, I still feel like there's some hesitancy to really push for more support and education.
Thank you so much for speaking up and being brave to do so. And, just to continue this discussion, Elliot, maybe you want to respond as well. I'm just wondering, do you think there's any way of kind of dealing with that? Is there anything that you feel that can be done?
I wasn't sure if you were.
Yes, I was talking to you.
Yeah. Yeah, like I said, we do have an LGBT aging coalition for Ventura County, and they do, education seminars, and they're really awesome. I'm part of that coalition, but I don't know, just in terms of bringing it forward to certain agencies, it can be tricky just in terms of who is involved with that agency and kind of what their beliefs and biases are. But yeah, I don't really know. I don't have an answer for that.
It's a complicated question and issue.
Mm-hmm.
I saw something on the chat, Elliot.
So Bill shared that he's not able to do audio or video, which is fine, and we appreciate his chat. He said older generations fought for visibility and rights. Younger generations are experiencing an erasure of personhood and their rights, related trauma between generations. Reversal of the APA decision that you were mentioning, Lucy, did not erase the generational damage done to that generation. President Eisenhower and the APA set the foundation for structural and institutional biases. And he said the concern is that traditional physicians, internists, physician assistants, et cetera, are not attending LGBTQ+ specific health conferences. They are missing huge knowledge opportunities. I completely agree. especially as a health educator myself. For several years, I taught medical students. Now I teach nurses, PAs, and OTs, PTs, the whole gamut. There is training that is integrated into all of their curricula, but many people don't necessarily have real life experience working with diverse communities and getting to understand and experience how their needs might be different. And this is an issue. In March, actually, I was a guest speaker for Age Options, which is a AAA out of the Chicago area. And they're one of very few AAAs that have dedicated services and staff for LGBTQ elders. So it was a very unique experience for me to be able to speak to a larger audience of people who were experiencing discrimination and internalized homophobia and homonegativity, which come from those institutionalized generational issues that Bill was just writing about. If you grew up at a time, for example, in the 50s, when homosexuality was considered to be a mental disorder through your young adulthood, that can have a profound effect. And I think that does carry to many caregiver issues later in life now that we're seeing among seniors, and issues like homonegativity and internalized homophobia, which is just that feeling of stigma that you grew up with winds up residing within you. For many gay couples in the US, and this is one of the reasons why a lot of seniors are not necessarily married if they are gay and choosing instead to remain in a domestic partnership, because the option to marry only became federally legal in 2015. So for many older couples who'd been together a long time, they may not have recognized the significance of marriage and the implications of federal benefits like Family Medical Leave Act, as an example, to take time off from work and care for a loved one, and also spousal benefits through Social Security. So this is again why it's such a concern that if this right is taken away, what are the other ramifications? Now, there are a lot of financial survivorship issues that come into play as we age, and Social Security benefits, as an example, can play into that. The issue too of Family Medical Leave Act is a very big one, and one of the reasons why many older gay couples who are married feel concern about that protection being taken away, because then how do you extend healthcare benefits through an employer if you are working, or how do you take time off and account for that? One of the challenges, back to the conversation Lucy and Miranda were having about how do you change things, is I think through understanding need. And that was actually how, as I understood it, Age Options of the Chicago area came to provide their dedicated services because they recognized a need in their community. And what's important to note is that the US Census has actually never measured how many LGBTQ plus people live in America. So we know that the census is used to help coordinate budget and funding for resources, how many hospitals we need in our community, how many AAAs will people be served, things like that. So it's important that we know how many people are out there in order to know what their needs might be. There are some rough estimates that there will be about 7 million LGBTQ adults over the age of 50 by 2030, and that's right around the corner. Seniors and caregivers are facing a lot of issues because they're twice as likely to live alone and 4 times less likely to have children. And as a result, elders in our community are more likely to need long-term care. Yet, according to an AARP recent survey, over 60% of adults in the LGBTQ community are concerned about mistreatment in long-term care. And since the pandemic, we know staffing shortages have been widespread along these facilities, which have furthered concerns about accessing facilities that are welcoming to LGBTQ plus seniors and that even have the time to train their staff. And this is such an area of importance that we're actually dedicating an entire program to the topic next Wednesday. We have a link here on our screen, and again, we'll be providing a copy of our handouts. because people are not sure what to do in this evolving time if you encounter mistreatment, especially since laws in some states permit for that, actually. So this whole topic is really an important issue and also an important one for younger LGBT individuals as well. It's so important to start planning and saving early so that you have as many options as you might need as you age. And many people don't realize that LGBTQ plus adults become caregivers more than their heterosexual counterparts. And that includes our community too. I don't think that we realize that we become caregivers at a higher rate. And if we thought about who would care for us later, maybe we would plan better. If we thought about who would look after our parents among our siblings or friends close to us, we might recognize that we bear more of that responsibility. And it's a very hard thing to face up to and recognize. So since LGBTQ plus adults are less likely to have children, more of them actually assume caregiving responsibilities for aging parents and for other friends and chosen family. And what is so interesting is that despite the fact that we become caregivers at a much higher rate and frequency, we feel more isolation in our caregiving role. Now, I think this happens personally for two reasons. And one is that our society is youth-focused, and that's irrespective of gay or straight. But if you think about, or if I think about the imaging, the messaging that I grew up with around the issue of the LGBTQ community, I think it was something seen as funny or lighthearted as reflected back to me in television. And as an example here, I've included some major gay characters that I was introduced to growing up, from Will and Grace, or here even Nathan Lane in The Birdcage. And does anyone know how old Nathan Lane was when he filmed The Birdcage? 39. And at 39, he was one of the parents of the bride and groom. So it's just, I don't know, I think it's worthy of noting. And Robin Williams, by the way, was only 46. So again, very youth focused. And so I really appreciated when Grace and Frankie came out because they were addressing some issues facing older adults, including coming out late in life and sexuality among seniors, which is something that we don't talk about often, but the show changed gears and isn't really as grounded or rooted in that reality. So I think we really lack representation in our society of what the experience is of an older LGBTQ plus caregiver who may not have children to look after them, who might fear growing old, alone, or sick, or with no immediate friends or family to support them. I've never seen a TV show or a movie or a documentary about anything like that. I've also never seen anything about a child who is a caregiver, as an example, who might be gay and their parent didn't really accept it. We hear that from a lot of our participants and how challenging it can be to be a caregiver when you didn't really feel a lot of acceptance from a parent. So growing up, the context in which I understood caregiver issues of the LGBTQ community was really only in terms of providing care for those with HIV or AIDS who were young and dying. And there wasn't as much of a focus on people aging and needing care. And all of that has really changed now. And we lack representation of caregivers in general, but even more so when it comes to minority groups, I think. I saw that we have a comment in the chat that we all need the same good care, no exception of person. And I couldn't agree more. I wish that we saw that reflected more widely. This is the second reason, that I believe that in our society, this role of caregiving feels more isolating for our community is also that caregiving as a whole is considered a gendered responsibility. And I've shown this before, that if you do a Google image search, and I encourage you to try it at home, you can try it on your phone, you can try it wherever you are and with whatever browser you use, I think that you'll find the majority of the images that you see attached to caregiving are of women. And women take on the majority of caregiving responsibilities as we age, and that That is true according to National Alliance for Caregiving data and the AARP's Caregiving in the US report. So a Google image search using the term caregiver reflects this notion, and you'll see very few men represented, even fewer images of same-sex couples when it comes to caregiving. And if you think about advertising used for healthcare and long-term care, and even perhaps within the organization with whom you work, it might be rare to see the LGBTQ community represented, which underscores a feeling for many people of being invisible. And we don't see images like this that I'm showing you here when it comes to caregiving. Do you know how hard it was for me to find a photo of an older Black lesbian couple? It was so challenging on the internet to find that, and it speaks a lot to a lot of the disparities that we see. So play around at home, do a Google image search, look up terms like caregiver or LGBT caregiver or family caregiver. You will not find much diversity nor many images of men. Older men, you might find some younger ones. And I know that when I used to speak in person at caregiver groups across South Florida ahead of the pandemic, I usually felt like the only member of the LGBTQ community present. And it was really one of the reasons why we began this series, because we recognized how few safe spaces existed for men specifically to talk about caring for a husband, or for a woman to talk about the impact of her wife's illness, for example, or her caregiving role. So I'm curious, for those participating today, do you feel represented? Do you feel isolated? And do you feel like the notion of caregiving is gendered?
So if you have dialed in, you can press *6 on your telephone and that will unmute your phone. Others can just unmute their microphone if you've Zoomed.
I'll say, as I'm getting older and my husband is getting older and we're having more health issues, I don't feel like that's represented in our community.
That's, it's a question I think everybody kind of needs to stop and think about, that whether you're in the community or not. For example, I went to a new dentist the other day and I had to fill out a form. And the form, asks for your name, woman, man, whatever. And right away, all of a sudden I thought about this and I thought, wait a minute, how would someone from the LGBT community answer these questions? Because they were so geared the other way. And so it sort of dawned on me, and I did go to the receptionist and even spoke to the doctor about it, that the form needs to be changed. So when we talk about how do we change things, it could be simple things as that, which is not so simple, to be inclusive. So I'm going to check to make sure next time I see them to see if the forms have been changed. Yes, so it's very subtle sometimes that we don't even recognize it. We just accept it as that's the way it is. But if I put myself in someone else's shoes, then it becomes a really big issue of, am I even going to share that I'm in that community, especially if you're a senior?
Yesterday, actually, I was watching television and saw an advertisement for a new mental health medication. And they always have actors saying, oh, I feel better. And one of the people in the ad said, we feel better. And it caught me off guard. I thought at first there was maybe a copy issue or something wasn't right, or maybe the medication was for multiple personality disorder. But it was actually a person who identified as they. And so it would then be appropriate for them to say, we feel better. And you don't hear that kind of language being used very commonly. So one last thing I did want to mention, back to my point about LGBT adults being caregivers at a higher rate than our non-LGBT caregivers, very few people recognize that. And that also carries to employers and human resource managers. And it's an important economic issue for our community because many people lack paid time off sufficiently to care for themselves, let alone care for someone else. So it's no wonder that many caregivers in our community abuse substances too to get some relief, which is not a very healthy coping mechanism. But this is even more true within our community. And I think it is because of some of the issues that we've been talking about that exist in our environment and our society. So please remember, if you are a caregiver and part of our community, that self-care is so important. There is nothing bad that taking a walk will do for you. And I like that concept because, we don't always know where to begin with self-care. And taking a 5-minute walk might be a start. And if you're someone who works with the community, recognize the fact that we do become caregivers at a higher rate, and it makes sense. So we might want to think about that as we're working with others too.
I just saw something also in the chat from Bill.
Yes. Bill said, I'm unique. I have direct input to the County of Los Angeles Department of Mental Health, Los Angeles Department of Social Services, and State of California Department of Aging. Self and community advocate. Huge changes coming to California. State of California included LGBT+ persons in their master plan on aging. Seniors must become their own and best advocate. Bill, I applaud you. I echo exactly what you're saying and hope that you can join us actually for our program next week, because I'm going to be talking a lot about everything that you just mentioned. Many of you, I'm sure, don't remember that last June, President Biden had actually issued a proclamation for Pride Month and also directed some large federal agencies like HHS to create a Bill of Rights and Protections for LGBTQ seniors. So we're going to talk about where that is at now and how that links to all of these changing state policies.
Yes, so, Elliot and I were really determined to do these series. So we identified a lot of challenges, and over the course of our series this month, we're going to discuss some of them in more depth, as Elliot just said. We felt it was important to have a program to discuss the experience of LGBT seniors and caregivers. Just bringing these issues to awareness can feel comforting or reassuring for an LGBT community member. It's also important as a means of sensitizing one another to the challenges that exist. So despite these challenges, LGBT caregivers are strong and resilient, like all caregivers are. They are often able to overcome these obstacles and provide loving and compassionate care for their loved ones. So here are some tips for the LGBT caregivers to look at that again. It's so important to find a support group. They are limited, but there are many support groups available for LGBT caregivers. These groups can provide a safe space to share experience, connect with others, and get support. So please reach out to your community. There are many organizations that offer resources and support to LGBT caregivers. These organizations can help you find financial assistance, legal help, and other resources. Take care of yourself. Caregiving can be stressful. We know that. So it is important to take care of yourself very well. Make sure to get enough sleep, eat healthy foods, and exercise regularly. You should also find time to relax and do things you enjoy. So if you are a healthcare worker, think about some of the sensitivities we discussed today. Do you think that your organization reflects LGBT couples and marketing and even intake forms, as I was talking about? If you are an LGBT caregiver, you are not alone. There are many resources available to help you. So please reach out for help if you need it. And I think we have as Elliot always does, a wonderful list of resources. You are very resourceful, Elliot. And
well, you have to be.
And I appreciate that. I think that it is very important to be very aware of all the limitations, but also to be very aware of what resources are available. There's a lot of amazing people working in the healthcare system that are sensitive and want to help, even though there's a lot of work that still needs to be done. So here are some of them. You can go over that. You don't have to write them down, because as Elliot said, we always send you all the slides, so they're there for you to connect. And if you are a healthcare worker, and if you have clients or patients in the LGBT community, this is a wonderful resources to share with them as well.
And I want to say, we've shared a lot today about an overview of our current environment, a lot of the policies that are up on the table that actually restrict healthcare access rights, allow us to be discriminated against in healthcare environments, which is counter to the professional oaths that we take in any healthcare helping profession and field. Again, I remind everyone of that we take these oaths and they're important. But more importantly, there are other surveys and data and research out there. For example, GLAAD, which is a very large national organization, has found that the acceptance rate or the level of acceptance among non-LGBT persons of our community is at an all-time high among people, civilians, who live among us in our communities. This is just not being reflected in policies. And so we do need to come together. We do need to advocate, as Bill was saying, and we do need representation, I think, because right now, when I look at the news, I feel very sad and discouraged. But it's Pride Month, it's a time for hope, and I think it's also a time for us to come together and recognize the strengths that we do have. So anytime you see a resource in our slides that is underlined, it is a hyperlink. And again, we will share these with you. So these will take you directly to where you need to go. I mentioned also that the acronyms are sometimes a little different. So that's why you'll see here that there is a GLBT National Health Center. And that is a different acronym because of the history with which that organization was founded. And at the time, that was the acronym. There's also SAGE, which is the largest national organization that supports LGBT elders, or in their case, again, GLBT elders. And we have their hotline here at 1-888-234-SAGE. They have the most amount of information out there. If you need resources for mental health, please remember that you can call 988 from any phone. It is free 24/7. And we've also included a list here for LGBT community centers across the country through Centerlink. And that might be a great way for you to help link people up in your community with resources and also support networks. So I know that Glenda has some things to share with you, and I hope that many of you will stay on with us after the hour for an unrecorded conversation.
Thank you, Elliot. I just wanted to make a remark. I'm not part of the LGBT community, but I am an older adult. And I know that ageism is alive and well because I experience it myself as an older adult. And to put that together with being part of the community, I was just sitting here trying to process that. And quite a challenge is what I would describe it as. And I have such appreciation for the community and the challenges they do face. So thank you for letting me share that. So as Elliot and Lucy have said, this is the first in 4-part series, and I'm excited for that. So next week on the 14th at 10 o'clock again, they're going to be talking about tips on aging in place and finding inclusive long-term care, which was one of my head questions about how do you find those communities, those facilities that are LGBT friendly, if you want to call it that. So I encourage you to definitely tune in for that session and all the other ones in this series. As Elliot and Lucy said, you will be receiving all of these resources. If you did register for the session today, in a few days, you will be receiving a follow-up email, and in that email will be this particular presentation with all of the resources. We will also ask for your feedback about what you thought about this session. And please be honest and give us your feedback there. If there's things that you think that could be added, topics that could be added, please share that also. I would also say, if you have seen a speaker in your area or whatever that you think would be great on the Caregiver Teleconnection, let us know about that also in that feedback, in that questionnaire. Let me look over here real quick and see what else is happening on the Caregiver Teleconnection. Oh, Lucy's going to be back tomorrow, right, Lucy?
Yes,
And
I am.
Yeah, do you want to talk a little bit about that session? You have a special guest, I see.
Yes, I have a special guest, and her name is Dr. Jenna LaBelle, and she's going to be talking about chronic pain, caregivers who suffer with chronic pain. So we've never done this before, and it's a topic that's not researched very well, but she is an expert in the field, and so I'm looking forward to that.
Oh, great, Lucy. Thank you for sharing that information. So again, that's tomorrow at 10 o'clock Central Time. So tune in for that. I think y'all are still open to questions and comments. We have about 7 minutes left. There's plenty of time for that. And then I will get off of the phone. I will stop the recording and you will have an additional half hour with Lucy and Elliot. And I hope you will take advantage of that. Any other questions or comments about our topic today? We'd love to hear from you. Well, those of you that have seen me on as facilitator before, and I've been doing this a long time, I don't hold people over just to hold them over. So I am going to stop our recording and I'm going to say goodbye to you at this time. And I hope that you have a very wonderful conversation that popped up from Minerva. If you can see on the chat screen there, if you want to change your name in Zoom, she has given you that information. So you'll be able to do that and protect your privacy. So I've been a pleasure to be with you as always, Lucy and Elliot, and with all of you that joined us today. And I hope to see you on future sessions. So I'm going to stop the recording.
Thank you. Thank you very much. Bye.
Bye-bye.
Thank you so much.